Hi everyone, my name is Olivia Scattergood. For my self-management plan this intersession, I decided to focus on nail biting as the behavior. There's a little picture of me to the right from this past spring, just for some reference. So nail biting usually starts out as, I would say, a childhood habit, but parents often don't think of it as a problem just because kids always have their hands in their mouths, they're always chewing on something. I think it's a very common childhood habit. So they often don't think anything of it, but unfortunately for millions, it does continue into adulthood. And according to an article done by Tanaka in 2008, a lot of medical studies have found that in addition to just tearing up the skin and tissue on your fingers and around your nails, it can cause other serious medical problems later in life, such as bacterial infections and malocclusion of the teeth, which basically just means that they're going to be misaligned, especially because they're still growing and you're just grinding your teeth down when you're biting your nails, so that's no good. So a couple of other studies that I found, such as the one by Dufresne, Stewart, Watson, and Kosmersky in 2008, they just wanted to examine the effectiveness of some habit rehearsal on a single subject, who in that case was Mandy, and they just taught her to recognize her behavior, and her competing behavior was quote unquote catching herself. So the more times she caught herself, she didn't engage in the problem behavior, which was nail biting, and so her nail biting behaviors eventually decreased, and this was measured, her progress was measured by her total nail length during each session. So the nail length increased and the nail biting behavior decreased. And in the other subject study by Ronan and Rosenbaum in 2001, their subject was a 10-year-old boy named Daniel, and they wanted to use a multiple baseline across behaviors design to evaluate the effectiveness of their habit reversal, on bedwetting and nail biting. And so the intervention part for the nail biting mostly involves some self-intervention like predictions, verbalizations, and reinforcements, and just some general skills training. And so after the implementation of the intervention, bedwetting stopped almost immediately, and nail biting took around 6 weeks to stop, but did stop nonetheless. And in the same way, the progress was shown by the growth and recovery of his fingernails. So for my baseline, we wanted to record the frequency of nail biting versus the frequency of gum chewing as a competing behavior. And for my plan, nail biting is defined as any placement of a fingernail between the teeth and biting, grinding or ripping of any of the nails or skin around the nails, using your teeth for longer than 2 seconds, using frequency for this because it is a discrete behavior and doesn't happen too often. The same for the gum chewing. Gum chewing here was defined as putting a piece of gum completely inside the mouth and actively chewing the gum without swallowing for 5 seconds or more. Also used frequency due to it being a discrete behavior at a low rate. And for both of these, a paper pencil tally was used. The chart that I used was actually on the right side of the screen there. And my inter-observer data was collected by my roommate, who used the same chart. And on the bottom, you can see that graph that I have there that shows my baseline data. So you can really see that there was a high frequency of nail biting and a rather low frequency of gum chewing. And you can kind of see that the two behaviors kind of worked inversely. So if there was more nail biting, there was less gum chewing because you're kind of doing one and not so much the other. And for my self-interview, I kind of reported that I was engaging in this nail biting behavior when I was doing work for school or even just sitting on the couch watching TV. So I would stop what I was doing, start biting my nails, and then eventually continue with what I was doing. So the self-interview kind of suggested that the behavior might be maintained by escape from certain tasks or even automatic reinforcement. So my intervention of choice here was a DRA procedure. I was going to be altering the antecedent for the competing behavior and altering the consequences for both. So in this case, for altering the antecedent, I was just going to keep a pack of gum on me so that I was more likely to go and grab the gum and put it in my mouth, decreasing my response effort. So I didn't really have an excuse to not do it. And as for altering the consequences, if I were to engage in the target behavior, then I'd have to sit on my hands for 2 minutes as a consequence. And if I were to engage in the appropriate alternative behavior, which in this case was gum chewing, there would be a reward for that alternate behavior, which in my case would be a piece of my favorite candy. And these consequences were implemented by my roommate just to make sure that I was keeping myself on track here, not cheating or anything. So my results, just again, we were altering our consequences and antecedents, and we found that the combined application of these alterations resulted in a decrease of nail biting and an increase in gum chewing. So it pretty much did exactly what we wanted it to. I found that in my baseline data, the frequency for nail biting was between 5 and 11, which is rather high, and the frequency for gum chewing was between 1 and 4, so that was pretty low. But during my intervention, the frequency of nail biting went down to between 1 and 6, so that is a pretty drastic decrease. And for gum chewing, went up to between 2 and 6, which is more of a slight increase. So basically, in the self-management plan, we just wanted to examine the effectiveness of a certain habit reversal procedure on nail biting, and we did find that the intervention was actually effective in decreasing my problem behavior, which was nail biting, and increasing my alternative behavior of gum chewing. So of course, there were some limitations, as in most studies, just due to the nature of this course, unfortunately. We only had about 2 weeks to kind of get that baseline data and implement the intervention and do all the planning in between. So in the future, I would definitely lay out some more time for that. But like I said, just due to the nature of the course, there unfortunately wasn't enough time for that. In the same way, I can't demonstrate a functional relationship just yet because I didn't get to do any reversal. So in the future, I'd like to return to baseline and then implement another session of intervention, and in which case I would hopefully be able to demonstrate a functional relationship in the future. And then just a quick plan for maintenance, hopefully implementing some follow-ups in the future just to see how the skill generalized, and maybe some future awareness training just as a refresher, being aware of what nail biting looks like, when I might be doing it, but hopefully the goal is to get these prompts faded, and so I can be hopefully never biting my nails sometime in the future. And these were just some of my tables and graphs. The left was just my data from the intervention, and on the right was my entire little habit reversal graph here. So the baseline data is on the left side, and on the intervention you can definitely see a drastic decrease in the frequency of nail biting, and then a more like steady increase in the frequency of gum chewing. I think gum chewing is like a little bit of a tricky behavior just because you can only do it so many times, but it definitely means that the intervention did exactly what we wanted it to do and was effective. So yeah. So like I said, our intervention was effective, and hopefully sometime in the near future, my nail biting behavior will become extinct, and then I'll have this class to thank, and that'll be really cool. So I definitely am looking forward to using this self-management plan and procedures in the future, and I think that I definitely learned a lot from this class. So thank you for watching.